Senate Bill 462. Imagine this. Imagine you work at a daycare making modest pay, and you cannot find affordable childcare for your own kid. There is a long wait list, and families have been waiting months or even years. This bill moves you to the front of the line, but someone else gets pushed back. What the bill says it does? Senate Bill 462 says it helps childcare workers by giving their children priority access to state subsidized childcare slots so workers can stay in the field. What it actually does? This means childcare workers can move ahead on waiting lists while others low-income families wait longer. It also means the Texas Workforce Commission gains more control over how wait lists are managed, while local workforce boards lose flexibility. No new childcare slots are created. Who benefits? Childcare workers who qualify, childcare centers and employers who benefit from lower worker turnover, and business groups and chambers of commerce that want more stable workforce. The Texas Workforce Commission, which gains centralized authority. Who pays the price? Low-income families who are not childcare workers and get pushed further down the wait list. Home-based providers and some directors who are excluded from the definition, and local communities that lose control over how wait lists reflect local needs. Why it matters. Childcare is already scarce in Texas. When the state chooses winners without expanding supply, families end up competing against each other. Instead of fixing the shortage, this bill rearranges it. Over time, it also sets a precedent that access to public help depends on your job, not just your need. Questions to ask your lawmakers. If no new funding is added, how will the state prevent other struggling families from losing access to care? Why move control to a state agency instead of trusting local boards that understand local needs? And would you support regular public reporting or review clause to measure who gains and who loses under this policy? Bottom line, Senate Bill 462 helps some families by pushing others further back without fixing the childcare shortage at the root.